and welcome. You're watching FII. I'm Sonal Mehrotra Kapoor. Now, by now, everybody knows what black fungus is, why it is caused, and what are the symptoms you need to watch out for if you are a diabetic or you are somebody who's taken steroids during their COVID treatment. But as a fallout of black fungus and the enormous amount of cases that we are now seeing, lives lost as well in several parts of the country, the focus has come to the use of steroids, not just in COVID, but otherwise as well. So we thought on FII, we'll give you a full explainer on what are these steroids, and when it comes to them, what are the basic do's and don'ts you must know, things that you must follow if you are taking them, compelling a doctor to give you one, or hoarding on to these steroids during the pandemic. So let's get into our explainer. First up, what are steroids? Well, steroids are man-made version of chemicals similar to a kind of hormone in our body. When produced naturally, they are natural steroids. When introduced medically, synthetic steroids. Now, steroids are designed basically to reduce the amount of inflammation in the body. So, the thing to remember about steroids is it won't cure your condition, but they are very good at reducing the inflammation, which will ease symptoms such as swelling, pain, even stiffness, etc. But what happens to your body when you take these steroids? Now, usually, inflammation is the body's natural reaction to any sort of infection, bacteria or virus. Now, to fight out these bacteria and infections, viruses as well, our body's immune system can lead to swelling, can lead to redness and heat, or what you feel as very acute pain in a particular area in your body. Now, inflammation, remember, before I go any further, is a necessary evil. It is a natural immune response to these infections and also to any injury in your body. Most of us will have a balanced immune response to infection, and this helps us clear out that from our body. But some of us, our immune response gets dysregulated and causes an inappropriate level of inflammation. For example, in patients of arthritis, the immune system produces inflammation in the joints or other parts of the body by mistake, which can cause permanent damage if left untreated. Now, steroids are very useful in cases like these. They reduce that immune reaction. So, the important thing to note about steroids is that they reduce the activity of body's immune system, which is body's natural defense against illness and infection. Why I'm emphasizing on that, you'll just get to know. So, steroids are great in cases of asthma, etc. Several other diseases it's used in as well, but only when inflammation is out of control. Even then, it only works when taken in the right dosage, and that's the right amount and the quantity that your body really needs it in. So, what happens? Let's take the case of COVID patients. By now, the dexamethasone and the other corticosteroids, etc., are household names and are indeed effective in treatment in moderate to severe COVID patients who might require oxygen or ventilator support. Only these patients, remember. But they are effective if and only if given in the right dosage at the right time. Timing in steroids is extremely crucial. Now, experts say if not, then it can do more harm than good to your body. Now, to give you an example of when do steroids really work and when do they not in your body, let's again take the case of a COVID patient. Now, a body of a typical COVID patient will tend to have high level of inflammation. Remember, your doctors regularly keep asking you for blood tests like CRP, CBC, D-dimer, etc. This is to keep an eye on these inflammation markers. High level of inflammation also means that your immune system is fighting the virus, and the virus is actually on its way out. This stage is called the inflammatory overdrive. Now, that is said, this is the right time to introduce steroids in your body. If given too early, in the phase where what doctors call is viremia, or when the virus is still in the body, it may prolong the virus stay in the body, and while the patient may feel good temporarily, it will cause more damage in the days ahead. Similarly, if steroids are given for more time than needed, it can lead to secondary bacterial and fungal infections. Remember the black fungus? Exactly that. Also, the thing to remember about steroids is that they should be weaned or tapered off. That's gradual reduction of doses, especially when consumed for over 21 days. Now, since steroids have a feel-good factor, patients tend to continue them even when the doctors are asking them not to. That should be avoided. And if in these patients you see complications later, it is these patients and those with diabetes that we've seen get black fungus. Really, it breeds in patients like these. So you need to remember all these pointers that we've just given you the next time you pressure your doctors into starting you with steroids. Again, as always, let your doctor decide. Each patient is different, and the details I shared with you are simply FYI for your information. All right, having understood that, and I hopefully made it a little clear to you what exactly happens to your body when you take a steroid, let's introduce our panel. We've got Dr. Arvind Soin join us. We have Dr. Sumit Ray also with us, Dr. Vishal Rao, and Dr. Pinto also with us. Thank you so much all for your time. Dr. Pinto, if I can begin with you to try and understand what exactly happens, when should steroids be used, and mostly to remind our viewers, when should they not be used?
Thank you, Sonal. I think you covered it excellently in your initial brief. I think timing, dosage, and duration, these are the three things that are extremely important when starting steroids. If you realize about 85% of individuals with COVID-19 will heal by themselves. It's their own natural immunity which takes care of things. Usually they have fever which can last anywhere up to a week sometimes. At the end of the first week, they start feeling better, the oxygen levels remain stable, and they really don't need anything further. It's the body's natural defenses which take care of things. It's a small proportion of individuals who usually, towards the end of the first week, after the viremic phase is over, the virus is almost on its way out, but the body for some reason has mounted a hyperimmune response. The body is trying to fight it a lot more enthusiastically than it should. And that hyperimmune response, which you see towards the end of the first week, very often causes a drop in the oxygen levels. This is the time where steroids really work, where oral steroids really work. This is the time where this hyperimmune response needs to be calmed down, needs to be quelled. And steroids are excellent drugs at doing that. So if you see the largest trial which was done for this was the recovery trial, which proved that when used at this stage, when the oxygen levels have dropped, steroids can actually save lives and reduce mortality. So you can actually prevent people from dying if you use it at this stage. However, if you use it too early, you can actually cause harm, because that natural immune response, which would have taken care of the virus for 85% of individuals, you probably hamper that natural response, and you lead to these individuals being exposed to a prolonged viremia, a more vigorous viremia, because you've lowered their defenses, and that's where it shouldn't be used. So that's as far as timing goes. The dose that was used in the study was 6 milligrams of DEXA for 10 days, up to 10 days. That's the standard recommended dose. So using it in just about this dose for just about 10 days is what is really recommended. Unless there might be exceptional circumstances in which you go beyond 10 days. But as long as you stick to these principles, by and large, you shouldn't have such a high incidence of the black fungus as well.
Right. And a lot of people at this point, I think why it was so important for us to do this program is to tell them, do not just hoard all these steroids at home thinking that you're going to need it. Do not take it when your doctor has not prescribed them, because it can actually do you more harm. Dr. Sumit Ray, what kind of harm are we looking at? If you could just explain that to our viewers as well, and not just in the case of COVID. In fact, let me take it beyond that. Even with acute pains, etc., we've seen people, self-prescribe steroids. What does it do to your body?
Well, one must realize that all medicines have their pros and cons. Whenever we are using a medication, we have to see the positives along with the negatives and balance those out, and the need for that drug. And that is true of all drugs, and it includes steroids. So as Dr. Pinto and you explained, that the need for steroids is there. What is the harm? The harm is secondary infections, bacterial infections, fungal infections, causing septicemia, and mucormycosis is only one small part of it actually. Patients can get other kinds of infection. Having said that, I just want to add a little bit more, because it seems so simple that you need to just use steroids, little bit of steroids for 5 to 10 days, and that should be okay. Then why is this happening, that people are using more, longer and higher doses? So why it's happening is, I think there are two reasons. One is probably not just the patients, but also doctors have become hyper enthusiastic about the steroids. They think that all patients require steroid. One size does not fit all for any disease, and it's true for COVID also. The other is that the subset of patients which we see as an intensivist, they have an even more higher inflammatory response. So not only steroids are used at a higher dose, but a subset of them actually, there is a small subset where tocilizumab or itolizumab, these are the immunosuppressants, are also used. Because these patients have like the cytokine storm or whatever is become the popular term now. So those patients require even higher immunosuppression than can be provided by the dose of steroids that we have been talking about. So in that subset, timing it, extending it for the right time, it is not a perfect science to tell you. It's not an arithmetic science, I would say, right? It's not arithmetical. So it takes a little clinical judgment, effort, and individual patients behave differently. And the subset of patients who are diabetics already, are those who are more prone to the black fungus or the mucormycosis,
Right.
Uncontrolled diabetics with acidosis, as we call it. So that is the combination. So having said that, most patients, as Dr. Pinto said, do not require steroids. Among those who require steroids, most of them will require very low doses of steroids. It's only the really small subset who land up in the ICU who would require slightly higher doses of steroids.
Okay. So having understood that, lots of important points in what Dr. Ray has just said, let me bring in Dr. Arvind Soin to the discussion now. Dr. Soin, then, if I look at the WHO guidelines over here for the uses of dexamethasone, it says 6 mg IV or oral or for about 7 to 10 days. And then it says about the hydrocortisone, it says about 50 mg IV every 8 hours, again for about 7 to 10 days. But then it says in bold letters, in most seriously ill patients. Then how is it that this drug is given over the counter in the first place? Shouldn't that be an issue we are addressing?
Sonal, steroids are clearly a double-edged sword. So that's why we have to use utmost care in prescribing them, or for that matter, as a patient, taking them, especially on just WhatsApp advice or just because my friend's doctor gave them this, so I'll also take it. That's a very wrong thing to do.
Or just watching it on TV. I'm the first person to admit it. Don't listen to us, listen to your doctor.
I must admit you gave a good summary, but I mean, that's again not the ideal advice to take. You have to be with a COVID specialist.
Yes.
If you actually go ahead with taking them. So as Lance and Dr. Ray have clearly spelled out, mild patients, which is 85 to 90%, don't need it. Moderate patients need it for 5 to 10 days at small doses, the doses you've just spelled out. These are okay. And severe patients, which is hardly 2 or 3% of the patients, we use them in very high doses. And those are the guys who will typically need to have a steroid taper because they will need it probably for longer than 21 days, which is something you correctly pointed out. But there is a tendency among doctors, I'm afraid, to taper steroids even when they only need them for 10 days. They say, okay, you've had the 10 days of steroids, now you take a taper for 7 days at a lower dose and another 7 days at an even lower dose. No, that's incorrect. You can give steroids to moderate patients for 5 to 10 days and stop immediately. There is no need for a steroid taper for short-term steroids.
Okay. You said
the reason why severe patients
is what you're recommending.
Yes. Okay. Only if you're getting steroids for more than 21 days, and those are patients who are in the ICU, usually on the ventilator. They may or may not go on the ventilator, but they're in the ICU needing support. Now, the reason we give steroids for these patients is that if you don't give steroids for a long time, then they develop lung healing with fibrosis. So you want to do away with the inflammation so that there is no long COVID or post-COVID sequelae with fibrosis, which basically means lung damage. So that's the reason why a very small percentage of them need it for long term. The rest do not need it for long term. The other thing which Sumit pointed out, the diabetes. Now, diabetes and steroids have a very close link. The higher the dose of steroids, the more the blood sugar becomes. That means the diabetes goes out of whack. And you have to control diabetes with insulin. Even if they didn't have diabetes before, or they had diabetes that could be controlled with oral drugs. In this particular case, they will need insulin in the hospital to make blood sugars okay, and steroids only if necessary and as long as necessary.
Right. I think bottom line here is, like I said in the explainer as well, this is just FYI, remember, this is just for your information to understand what's happening. Your doctor is the best person to tell you how to handle these situations. Let me bring in Dr. Vishal Rao at this point. And Dr. Rao, if I can come to you with a specific question that a viewer actually wrote to us. If we can have question number 1 on screen, please, for our panel to also have a look at. This is from Umar Hassan. And he says, if anyone has COVID symptoms and RT-PCR test results are late, which is generally happening now in the country by 4 to 5 days, will they take steroids between the 5th and the 6th day because of the coming of the results late? How do I even give the right picture to my doctor? This is a bit of a desperation question, I figure, already, but why don't you take that up, please?
So I think to answer it, I think already the panelists have very nicely summed it up, and you yourself have given a very nice elusive discussion to it. What I would like to add to this is, today if you look at patients of black fungus, which I think I've been seeing the last couple of days, they have a very classical set of predetermined factors that have contributed to this. One is they were COVID positive. Second is they were either pre-diabetic or diabetic. They used steroids, which was not monitored correctly, and some of them have used oxygen. They've got oxygen supplementation, and lastly, the one thing that I found quite stark was they were all not vaccinated. So these are the 5 points that I saw very clear coming out in our patients of black fungus. And this is purely the principle, this is purely the part of the infodemic which has happened because of what we call self-help, self-care, self-medicate formula. And that has led to this kind of a confusion. I think Dr. Arvind, Sumit and Dr. Lance very clearly told this again. Steroids should be only used in patients who need oxygen, or in patients where the CT score is above 15. That is in those indications where you strictly use it, and that is where you can get a proper advantage. Indiscriminately using it in early stages worsens and promotes the viral load increase,
of course,
and defeats the purpose.
All right, let me bring in Dr. Pinto at this point. So what exactly are the sort of long-term side effects that we can see in steroids? And again, I mean this not just for COVID, but regularly people who might be using it as well.
There are acute side effects that you see instantly, which is the rise in blood sugars. Sleep-wake cycles get disturbed, so people find it difficult to fall asleep. So insomnia is a common side effect. People tend to get very irritable. These are the immediate acute side effects which people generally tend to notice within a day or two, especially the sugars going up. So that's a real, genuine side effect. Now, as a consequence of the sugars going up and your immune system being suppressed, you therefore become vulnerable to bacterial infections, you become vulnerable to fungal infections, and that's the second problem. So bacterial infections often can happen very soon. Again, 4 to 5 days of steroids given at very high doses, for example, can suppress your immunity to an extent that you become vulnerable to a secondary bacterial infection. So that's something that we need to watch out for in general. Now, if you use steroids for a prolonged period, as they use in certain diseases like rheumatoid arthritis, autoimmune diseases, you can have weakening of your bones, you can have weakening of your muscles. So you have something called a myopathy, difficulty in getting up from a squatting position, for example, because your muscles get really weak. You get osteoporosis commonly as a side effect. There are different long-term sequelae, including cardiovascular disease, including your kidneys getting affected, etc., which can happen depending upon the length of time that you give it for. So these are often side effects that we see in individuals who've been on prolonged doses of steroids, even for diseases like asthma. Once upon a time, we would give oral steroids. This was about 30, 40 years ago. And then people realized that these are really dangerous drugs to be given on a prolonged period. Right. Same with pain. I mean, the whole category of non-steroidal anti-inflammatory drugs came up in response to the realization that giving steroids for a prolonged period of time caused a lot of side effects.
Right. And I think the takeaway from what you've just said is not just physical impact, but the psychological impact also that steroids have. We've been reading in extreme cases it can lead to rage, it can lead to depression as well. So that's something that we need to be very careful about. I'll just like to take the next question, please, at this point, if that can be put up on the screen. This is by Pankaj Seni, who says, I just want to know that people who use to take steroids for body muscle in gyms have what kind of immunity, and why isn't it sort of prohibited for them as well? Dr. Ray, would you like to answer that, please?
So the bodybuilding steroids are a little different. They are the anabolic steroids, a little different from the steroids that we use in medicine for other reasons. I mean, the immunosuppressive steroids, but they do affect the body in multiple ways, particularly, again, some amount of effect on fluid retention, on immune response. They are affected, and multiple other things which will manipulate the immune response that we build up for our other infections. So those could be harmful. If people are on anabolic steroids for muscle building, those could have a negative impact on the immune response that is propagated by the body on a viral infection or a bacterial infection. So one has to be, bodybuilding anabolic steroids have no role. For have any benefit except in a very small subset of people who are catabolic, it's very ill, etc. for other reasons. For bodybuilding purposes, using steroids is a bad idea, and it has lots of consequences which are harmful even in an infection.
All right. So I hope, Pankaj Seni, that answers your question. Question number 3, and I'd like Dr. Arvind to actually take that question. It's a fascinating one where this is Himanshu Das, who asks tons of cases where a person has a mild infection in week 1 and then all of a sudden a severe infection by the time they reach day 10. Now, and that's why some doctors prefer mild doses of steroids earlier, as the progression from the mild to severe happens very, very quickly. Is that correct?
As we've all said very clearly on this program, steroids have very little place in the first week. Why? Because in the first week, the virus is multiplying in the body, and you don't really want to give steroids at that time and hamper body's natural immunity that tends to suppress viral replication. However, now it is recommended that day 5 onwards, if you have significant upper respiratory symptoms like cough, especially with fever and expectoration, that means you're bringing out sputum, then you could take inhalational steroids at a dose of 800 micrograms of budesonide or Budecort twice a day as nebulizer. So that's the only steroid that is generally given at home earlier in the first week. Otherwise, these steroids that we've been talking about, which are oral or intravenous, will only be best given in the second week to people who have moderate or severe disease in hospital.
Right. I hope that answers the question for Himanshu Das as well. I quickly have time just for a last closing comment, and I think Dr. Rao hasn't spoken, so please go ahead, sir, your closing comments.
Yeah, I think just to sum it up, what's very important for people to know is, in early cases, please do not get caught with the misinformation and use steroid either in cell form or in the form of this. And most importantly, even if you have been advised some steroids which you are taking, strict monitoring of it is very, very crucial. At this juncture, we discourage people from using steroid. Any guidelines discourages from using steroids, and like the question that the gentleman pointed out to earlier, if you have taken steroid in the first week and you are accelerating the disease, you're going to end up with a more complicated course of the disease.
All right, gentlemen, we'll leave it there for the moment. I think the bottom line really is that do not self-medicate, not for COVID, for anything else. Take the advice of your doctor and let them decide when you need, what you need, because like I said, every patient is different, needs to be monitored differently. Thank you so much for your time, doctors, and big thank you for everything that you do every day as is. That's it on FII today. We'll see you again tomorrow, 6:30. Bye-bye.